I thought it'd be fun to kind of talk about the things that I, as a plastic surgeon, look for a few surgeries.
Right.
You know, because I, as a plastic surgeon, can pick out people that have had plastic surgery easier than the average person. So, you know, just for fun, I would talk about some of the things that I look at. So I did bring some pictures, and hold on before you throw up the first one there. But the first one I did want to talk about was tummy tuck, right?
Okay.
Because that's what she's had. So the things that I look for to tell someone had plastic surgery, first is, are any scars visible? Okay, that's the first thing I look for. 2 is the appearance unexpected. So in this case, with her, I would say, yes, it is. She's 54. She's had 4 kids. Would you expect her to look like that? The answer is no. And so, you know, common things are common. Is it more common that she's 1 in a million, or is it more common she had a tummy tuck? Well,
yeah.
I mean, I do a tummy tuck every week. You know, that's what I was doing before I came here. So they are very common. So for tummy tucks, and I did bring like a before or I think I don't know if it's a before and after, just an after. Travis, if you can throw up that next one. So I brought this picture, and this is pretty recent after surgery, because if it gets too far out, the scar kind of really fades. But that's where the scar would be for a tummy tuck, you know, there on the right side. And you can see that there's a scar on the belly button, which I couldn't see her belly button in that picture, so I couldn't tell. But that scar you see follows where that bikini line was. And so you can kind of like imagine, you know, what you would kind of pick out if you were trying to tell if someone had a tummy tuck. You know, 1, do they have an unexpected result? You know, like somebody that's had a lot of kids and looks really flat. And 2, can you see a scar? Not everybody runs around in a bikini, right? A lot of people, you know, are very modest and they're all covered up. But for tummy tucks, you know, looking at scars and also, you know, kind of knowing if that person's had a lot of kids and if they look perfectly flat, then maybe they have on Spanx or something like that. But it's possible that they've had a tummy tuck. So kind of the next one that, you know, is really common as far as talking about is breast augmentations. So with the breast augmentation, what I look for to tell if somebody's had it is you see in the right picture how the breast at the top has a curve. You know, on the left side, it almost looks like a ski slope. That's a very natural looking breast, you know, very normal looking breast. On the right side, you have this very rounded curve. And that's the telltale sign. Now, if you're wearing a bra, you can get that look with a good push-up bra, but you can't get it out of clothes. So like seeing that if somebody's like in a bra, it's like not necessarily telltale, but out of clothes, like you can look at that person on the right versus the person on the left and say, oh, you know, that's definitely an augmentation. Next one, so this is a person that's had a bunch of kids, and look how full the breasts are. Like they're very kind of full, they're all filled out. And to me, if I saw that person and knowing that, you know, they were a little bit older and had some kids, I'd be like, they've obviously had an augmentation. It doesn't look bad at all. In fact, I think, you know, the shape of the breast looks very good. But to me, it's kind of classic. That's a breast augmentation. The next one, so this is a patient that really didn't have hardly any breast tissue at all, and the implants make up the majority of the volume. And to me, I can just look at that and be like, yep, those are implants. Because the way I describe that is almost like it's like a cantaloupe on the chest. Like it's just so rounded. Like natural breasts are just not that rounded. And although I look at that and think, you know, oh, it looks, you know, good or it looks very, you know, aesthetically pleasing, to me it's obviously implants. And then the last, sorry?
I said yeah.
Oh, yeah. So the last patient, this is what somebody looks like if they haven't had kids and they get an augmentation. So when I look at this, the first thing I notice is it almost looks like the breasts look tense. Like that they're almost tight. And the reason for that is when people get breast implants and they haven't had kids, their skin's not stretched out. And they get this almost more tight look to the breast. And it's not like anything about, you know, the way it's done. I mean, most people who have not had kids and they get implants get this kind of really tense, rounded look. And that's the reason, because their breasts haven't undergone those kind of increase in size and then decrease in size. So yeah, that's kind of like for breast augmentation. I'll tell you, in clothes, it can be really hard to tell. But the one way you can like have some idea is it unexpected for that, you know, person to have breasts like that? You know, if you see somebody that's like, you know, 5'4" and they weigh, you know, 90 pounds and they have a D-cup breast in their clothes, you can just kind of assume that they've had implants. And for, you know, if you're not somebody that has implants, let me just tell you, there are a ton of people running around with implants. Like in our friends group, like, I mean, almost everyone has one. Yeah. They're just very common, at least here where we are in Dallas, you know. All right, so facelift is the next one. So with facelift, the scars run around the ear, and I'll tell you, those scars heal so well that I've had patients come in and I have to ask them if they had a facelift, because even though I know where to look for the scars, they heal so well and they hide right at the border of the ear that a lot of times, unless something happened where they didn't heal well, you can't really tell. Once again, you kind of go to, is it an unexpected result? Like if somebody's 75 and they look 50, I mean, either they're doing a lot of laser treatments or they're a freak of nature, or maybe they had a facelift. But there is one thing that can go wrong with a facelift that you can pick out pretty quickly. And I've seen people like this, and actually I've been like, oh, well, I didn't say you've had a facelift, but in my mind I'm like, they've had a facelift. And that's a pixie ear. And I pulled this off. I haven't actually had a patient have a pixie ear. This Dr. James Pearson is a Beverly Hills facial plastic surgeon. He's very well respected. And this was on his webpage, and he actually corrected it that this person had surgery somewhere else and then came to Dr. Pearson to get it fixed. So the picture on the left is a pixie ear, and you see how the ear is almost pulled downwards? Like it looks like it's almost under an undue stress there at the very bottom of the lobe.
Yeah, like she has like her lobe isn't connected.
It's like it's attached, but it's also pulled.
Yeah.
So that's classic pixie ear, and there's a way when you do facelift to prevent that from happening. But sometimes you get careless surgeons, and they get these pixie ears, and then they have to be corrected. And he did a great job. That's a very nice revision of pixie ear. But if you see that look on the left, but look, you can't see the scars otherwise, right? Like look at that picture on the left.
Yeah, and then some people's ears are just like that. Like some people don't have like.
They have attached lobes.
Yeah.
But notice that it almost looks pulled down, though. That's the difference between a pixie ear and an attached lobe. So
I wouldn't have known.
So the other surgeries like liposuction, almost impossible to tell. I mean, if you saw somebody like in a bikini, the thing to look for would be for scars, but they're only about like that big. I mean, they're like, I make like 1 centimeter or sometimes half centimeter incisions for lipo. So lipo, it's like really, really hard to tell. I mean,
I have a question too.
Yeah, man.
When you are like getting a facelift, what exactly is that process? Like, what are you doing? Are you like cutting and stretching?
Yeah, there's two parts of it. So you make the incisions around the ear. It's on the front and the back side, and you're opening up the area in between the skin and the fat layer and the deeper muscle layers of the face, and the same thing in the neck. Skin and the fat and the platysma muscle, which is that muscle right there. You're separating those layers, and then you're tightening that layer on the inside, the fascia or the muscle with suture to kind of pull it in a direction back and up. And then once you do that, like you're gonna have way more skin. So after you do that in the face and then do that in the neck, then you pull the skin in the same vector, which is up and back, and then you trim the skin. So you're tightening the inside part, and then you're tightening the outside part, which is the skin.
Sure.
And they're great surgeries. I mean, I specialize in breast and body, but I still do facelifts pretty commonly. I mean, I don't advertise as like, oh, come get your facelift from me, but I have so many patients that a lot of times, patients that I did other things or done other things for will be like, hey, can you do a facelift? I'm like, yeah, sure. I mean, I'm not out there like, hustling to get them, but I can do them because they're pretty straightforward surgeries, to be honest. Yeah.
How long do they last?
So I tell everybody the same thing about facelift and neck lift. If you're gonna get a facelift and neck lift, it doesn't stop the clock, but it turns back the clock. So say you look 65, you get a facelift, you might look 50. But then time will still march forward, but you've reset the clock like 10 or 15 years.
Oh, okay.
Yeah.
Makes sense.
So the last one I was gonna talk about was rhinoplasty. Now, you cannot see the scars on rhinoplasty. It's just impossible to see. The only way you can really tell if somebody's had a rhinoplasty is if you've seen them before and you see them after. And my favorite person that got a rhinoplasty, throw it up there, Travis, if you would, is our girl, Jennifer Aniston. But she's a beautiful woman, even before she had a rhinoplasty. But you can see that her nose looks completely different on the left versus the right. And the only thing that really would do that is rhinoplasty, and she's been open about the fact that she's had a rhinoplasty. So.
Yeah.
So anyway, those are some of the common surgeries that people, will say, oh, is that person had a facelift? Is that person had a breast dog?
Yeah.
And so I just want to go over things that I look for because it can be hard to tell, and in close it can be super hard to tell. But,
Yeah.
All right, very good. I haven't had any plastic surgery. No.
I feel like I'm a better judge of plastic surgery at this point now.
Dude, I feel like you could be out there like teaching people.
Yeah, facts.
Like
I'll
both
be like,
you
yeah,
guys. Yeah.
Yep, I see it on you. I see it on you.
I see it. I know.